I wanted to talk about some of the nuts and bolts of the procedure. The first question is probe choice. So most of us at our institutions will have easy access to a linear probe. And do you think the linear probe is suitable? So when using an ultrasound guided linear footprint probe, is that suitable for the majority of paravertebral blocks?
It depends on the weight of the patient, the mass of the patient. So linear if I can, curved if I must.
I think that summarizes it really nicely, because actually when I first started and I learned these from John McD, I only learned them using a linear probe, because that most of the ultrasound machines I had access to just had one probe on them. So we had a linear probe, and if we wanted to get a curved array probe back in the day, it was a bit of a pain. So I made do with a lot of my blocks using a linear probe, but there was the odd patient where it became difficult. Things are a bit deep, or I want to ask you about this in a second after we talk about positioning, or the absorption of the tissue, be that the fat or be that the muscle, was such that it made imaging of deeper structures a little bit more challenging. So I struggled. There's definitely a few blocks when I thought, I don't know how I'm going to manage this. And this is before the block was described. So I kept trying to get my needle deeper and deeper, and sometimes I abandoned it because it was difficult. The curved array probe has been an absolute game changer for me.
Mm.
So I think you're right. In the right indication, if you don't get a great image with a linear probe, make a very quick decision to switch to a curved array probe, because it suddenly makes things a lot easier. But you lose some of that clarity, some of that resolution,
Yeah,
obviously.
yeah,
Um,
agree.
you'd agree with
Yeah,
that?
I agree with that. Well, unless the patient has a BMI over 40, we'll typically put a sterile probe cover on the linear probe, but have another probe
Yeah,
cover ready to go in case we can't just see those fine details, and we'll switch to the curvy.
absolutely. Now, this is